We had this 100,000 target, and
Yes.
there was a bit of a sense that maybe you were just showboating with that. You were trying to show us what you could do, and you hit 120,000, and now it turns out some of them were just letters that were sent. Yesterday, we were at 63,000 people tested. 85,000 tests, 63,000 people. We're falling back, and we're all just wondering, was that 100,000 just for show?
No. The 100,000 tests by the end of the month was the testing capability that we needed to build up. I set this big target. It galvanized people, an amazing group of people, public and private sector, NHS and companies, to pull together to make it happen. I'm really pleased that we hit the target, 122,347 tests, I think it was, on last Thursday. The number does dip over the weekend, and we saw that, and I fully expect it to rise again, and we're going to keep building that capacity. The capacity today is 108,000, so that's good, and we're gonna keep increasing that over the weeks and months ahead. And in a way, this the test, track, and trace system that we've been talking about on the Isle of Wight is an example of what you can do once you get this mass scale testing that I've managed to build. And you can do that because, when somebody has the symptoms, they can then go and get the test, a bit like, some of the hosts on ITV.
Understood. But when we look back to January, we just discovered that in 3 months into this country, 18.1 million people, 18 million people arrived. 273 only were quarantined. We needed the testing back then. We needed it in February. This is too late.
Well, it's easy to say that now, but we were only inventing the test in January, and in February we got it up to 2,000 tests from 1 or 2.
And look at Germany.
Germany started with a huge diagnostics industry, over 100 labs. We didn't have that industry here. And then over March, we got it up from 2,000 to 10,000, so we a multiple of 5 times. And then over April, I wanted to go further, so I said that we'd multiply it by 10, and we did that. So yes, it's been an unbelievable effort increasing the testing capability. I think everybody can see why that's important. And now it means that with this test, track, and trace program, we'll be able to hold the R down, so we have fewer new incidences of the disease, whilst also, I hope, being able to release more of the measures safely, because we've got a more targeted approach, essentially, a more targeted approach to tracing the virus. And we've been able to build that in a very, very short period of time. It's been an extraordinary effort by a very large number of people.